Namaste. A warm welcome to all of you present here. On behalf of Nirvikalpa, I thank you all for being a part of this panel discussion. This panel discussion is going to be among practitioners of dance, of different dance forms like Kuchipudi, Odissi, Kathakali, Bharatnatyam, and so on, and how essential it is to have the support of an alternate profession backing you, and whether it's a good choice or whether it's a better choice rather to be a full-time practicing dancer and to balance a career at the same time. So this is going to be a heartfelt exchange of thoughts, and the process of how we have all reached where we are and how our current journey is. And I'll be the moderator for this panel discussion. My name is Hamsa Chandraskar, and it's such an honor to have you all on this panel today. I'd like to request you all to introduce yourselves so that our audience knows who is doing what at the moment. And I'd like to begin with Sahana.
Namaskaram. I'm Dr. Sahana Selvaganesh, and I have been practicing Bharatanatyam for the past 25 years. I am also a dentist, assistant professor at Savita Dental College, and I have been managing both of my professions all this while. And let's discuss. I'm very excited to discuss all the aspects of how to manage both. Thank you.
Thank you so much, Sahana. It really excites me to know the kind of background each of you come from and to know the diversity we have in this panel today. I'd like to ask Pooja Kale to introduce herself.
Hello, Namaskaram, everyone. I am Pooja. I am an Odissi dancer. I started learning Odissi from my childhood. So now it's been 18 years. I am into dancing. And then I pursued my master's. I did MCOM and MBA. And then I was working with an investment banking company in Pune for quite some time. And it was 5 years, in fact. And now, from 2 years, I have completely uh, put myself into dancing. Yeah.
Awesome. Thank you so much. I'd like to invite Lekha Prasad to introduce herself.
Sri Gurubhyo Namaha. Namaskaram. I am Lekha Prasad, a Bharatanatyam dancer from Chennai. I've been training in this art form for the past 20 years now. I'm a graduate in architecture. I finished my master's as well. I'm also a master's in fine arts in Bharatanatyam recently, and looking forward to this discussion. And architecture and dance are two professions which are creatively aligned and they do complement each other. So I'm really looking forward to this discussion. Thank you.
Thank you so much. So far we've got, apart from all of you being practicing dancers, we've got a dentist, we've got a former investment banker, and we've got an architect. And I'd like to ask Aparna Satheesan to introduce herself.
Namaskaram. My name is Aparna Satheesan. By profession, I am a full-time dancer and a full-time software engineer. I know how that balance happens is the talk today, so I'm excited. I started my dance journey when I was 3, and there was no break in between, and it's still continuing. And I'm so blessed and happy to have wonderful gurus who guided me in the right path to continue what you love, at the same time balance a career that also helps you in a way to support your art and the art as an artist too. So I'm currently a software engineer developer working for a security company settled in USA. At the same time, I run a dance school here. I'm focused more on Bharatanatyam and Kuchipudi, try to balance on that too as well. So looking forward to the discussion today, to all the wonderful artists here.
Thank you. Thank you so much. I'd like to invite Ms. Ramya Suresh to introduce herself.
Namaskaram. I am Dr. Ramya Suresh. I'm a Bharatanatyam dancer from Bangalore, actively performing, teaching here. I'm also a medical doctor, just graduated recently as a pathologist, and now I'm working at St. John's Medical College and Hospital here in Bangalore. So happening dance and medicine happening side by side, and looking forward to talking all about this.
Thank you. Thank you so much. So all of you come from different career streams and you've all had such different journeys, right? So I think my first question is something which all of you are going to find very relevant and instantly hitting. So I was just thinking, have you all faced any stereotypes or misconceptions about being a dancer and at the same time balancing a different career? For example, if you're a dancer and if you're also a medical student, have you ever faced any kind of stereotypes, or have you ever been just put in a box on being a dancer while being a medical student, or while being a medical student and then like having another profession at the same time, or I mean any profession for that matter? Have you ever been stereotyped just because you're a dancer balancing another profession or balancing another academic dissertation for that matter? We can probably start with Ramya.
Throughout my education during undergraduation as well as post graduation, I haven't faced that kind of a thing from my medical field as such. They were all, in fact, pretty happy and proud that I was able to manage it. It's when you slack, you can't give them an opportunity to find a mistake. So when they find the mistake in you, they'll be like, it's because you're doing another thing that you're not able to give your 100% here. So it's about being there 100% in both, so that you don't give an opportunity for someone to bring the other profession as an excuse or as a reason to find a fault.
Aparna, you are in the software industry. You run your own dance school. Have people just ever asked you? See, you have your dance responsibilities and you have a family as well. So you probably need not take this up. Have you ever had that kind of a tone ever, being put on you?
Definitely, I have came across that, but not in a negative way. I haven't faced, but in a positive way. On my corporate life, this question always comes when they see my performance pictures or performance video, especially in the US. They are so fascinated about the art itself because it looks and feels different than what they normally see here. So they are very supportive and encouraging, and most of the time our performances and things here happen during the weekend, so that kind of like not clashes with my work in as such. But on the other side, this is a question that I have always faced, is everyone asking, hey, how are you able to focus on the dance? Because both the career requires immense dedication, time management skills, and you have deadlines. So it is challenging, but how are you doing it? How are you able to manage is a question that we always face. I think there needs to be a good time management and balance between, and on top of these two careers, you also have a family that you need to take care of, right? So it's about the support system that you have around, whether it is in your office or in the dance or in family. That support matters a lot. I think that helps a lot in balancing all these simultaneously.
All right, all right. So, Pooja, I have to bring the spotlight to you now, because in this panel, you are the solo full-time dance practitioner here. So, is there a reason where these stereotypes, by any chance, the reason why you chose to become a full-time dance practitioner? Or was it something which you always had at the back of your mind? Okay, I'll probably just finish my academic qualifications and then have a career, and then now that I know I'm capable of having an alternate career, I'll give my full focus to dance. What was running at the back of your mind when you made this decision, and have you ever looked back since?
Yes. So when so like every tradition in the family, it is like you have to focus. If you want to do what you like, you also have to focus on the academics. So in my family, they were open to everything. Like if you like this, do it. If you like this, karate, skating, everything, you do it. But also, don't miss out on your studies. So that's how when I was doing my dance throughout my childhood, I never felt that disbalance, because my parents used to push me equally to everywhere. When I completed my master's, uh, I remember in my interview, interviewer asked that is your hobby dancing? I said yes, I am a professional dancer, and so he asked me, do you have a separate resume? of it. I said, yes, I have performed in many stages. I have learned this, and we were talking a lot about it. So I was that was my first interview, and I was recruited in that company. And then, but I was there with them for 5 years. That is a long period to spend in a one company. It was because the company also understood. Company, I would say, the people, the employees, the colleagues, they understood that how much important dance is also for me. So I was very fortunate to get through my interview, to get into that company, and to have that support. Apart from family, getting support from your company where you are working is very helpful, no doubt. And then, as you rightly pointed out, that I always had in my back of my mind that I want to pursue dance as a full time at some point of time in my life. So in my office, people used to say, "Why you are not pursuing dance as a full time? You are doing it so much better. Why you are juggling?" But then I was at peace that yes, I am want to do and I am doing it. I will decide when I have to do. And then after 5 years, I decided, yes, I want to experience, I want to feel how it is to be a full time dancer. And so far, the journey is really beautiful. So nice. Yeah.
So happy for you. Thank you so much. So my next question is, I think I'll direct this question to Lekha, because when she introduced herself, she said something about how both her careers. So you're an architect and a dancer, and both of what you practice are very creatively aligned at probably a higher level than people who pursue other professions. So does being an architect, that does that mindset give you a dimension to view dance as an output of geometric patterns, or do you really see any connect between what you do during the daytime at your at your firm, and when you dance afterwards? Does that do the two of them give you any insights while you're doing the other? Does one give you an insight while you're doing the other?
For me, from day one, it was very clear dance is what I want to do, and that is my profession. So there was never a doubt about is this a supporting or something like that. I am a full time dancer. That is what I am, and I love to be identified that way. And when after my 12th, when it came to choosing my what am I going to study or what is the course that I'm going to choose, architecture was something that complements dance and Bharatnatyam. And I, over the period of time, I felt studying about this would really impact my dancing. It would make it better. So that was the whole choice of why I chose to study architecture, because I wanted my dancing to get better. So that is how I came into architecture. And at every point, it's always been a dance which has which I identify myself with, and how it has taken me from one step to another. So Natyam, Bharatnatyam is what I am, has made me what I am today. So that's how architecture came into my life, is because of Bharatnatyam. So when I identify the way I look, the way I perceive things, definitely is, I find it to be different from the way the others see it. When someone sees it as a ball, or even a cricket ball, I probably try to see it, how is it complementing the space around, because it's all about what is dance is how movement uh, deals with the space over time, right? And that's what dance is all, that's what architecture is also about. How does a user use that space movement over a course of time? So that's how I see both complementing each other. And with the choice of my colors, with the choice of my designs, the way I choreograph, the way I perceive Natyam itself, really, architecture does complement my dancing. So yeah, my choice of my what I study was also because of my Natyam, because I had to be a full-time dancer. So what is it that will allow me to do it? Yeah.
I think that's a very smart choice you made, because I feel it is in this that moment of making a calculated choice that the rest of your journey on balancing two profession. I think it all lies in that choice you make at that moment. So it's a very smart choice. I hope it motivates our audience to take the right decision at the right time when the need comes.
I think
So
more than balancing, sorry to cut you, but more than balancing, I think it's more about for you to be able to dance continuously, because I feel education is something that is important for a dancer as well. And that really develops the way you think and perceive Natyam by itself. So even my guru and my Mahaguru have always insisted to say that you have be well read, you have to be well educated to actually, take dance forward, because it's education really complements your Natyam. So that way, I think, yes, my choice was because of Natyam.
So you mentioned about how education plays an important role. So I'd like to direct this question. I'd like to direct this question at the doctors in our panel. So I mean, both of you, you've spent 5 years working on your MBBS and BDS degree, and I'm sure there might have been some point where dance had to probably take a backseat, because I think compared to many other academic qualifications, I think the medical profession is just so demanding in terms of time and in terms of your energy, because you've got to stand for long hours at the labs, and you've got to do your internships and all of that. So at some point, did dance take a backseat? And if it did, how did you bring that back and balance the rest of your professional medical journeys with dance? So I'd like to ask Sahana first.
So to add on to the previous question and to add on to Dr. Ramya, I feel the passion in science, it is like innate. It just develops in you after you graduate your 12th, and you really want to become a doctor. That's what your mindset is. But you have one more profession. I have been dancing right from the age of 3. So I've always wanted to pursue both. So interestingly, both my parents are auditors, and they had chosen for me to take up accounts when I passed my 10th. And I still remember that I fought with them and I told them that I will only pursue science. And then I changed my group for my 11th and 12th. And then I went on to study BDS and now MS. I feel that pursuing science has to be done in that stipulated time. I can go back to dancing, but I cannot come back and do an MBBS degree or a BDS degree. And that is very crucial, because it is just an innate passion that you develop over the years. And the next question that you asked me, like long hours of standing, yes, it is difficult. And it is difficult to derive satisfaction of giving 100% to both, because it is demanding, because I will have a surgery in the morning, and I'll have to stand, and being a dentist, I have to peep into the jaws. My spine gets affected, my neck gets affected, my ergonomics is bad, and I have to realign myself when I dance. And definitely cross training will help, and yoga helps a lot. And it is demanding to manage both the professions and all my handwork. And I feel that most of the times when I work in the dental office, if I have to gain peace, I go back and dance. So these 5 years, and plus 3 more years for my master's, and now pursuing my PhD, I feel dance has been a really big boost, and it gets me back onto track. So if I'm lost otherwise in dentistry, I fall back to dancing and my guru. That's about it.
Dr. Ramya, can we have your thoughts on this?
So for me, pursuing MBBS and dance, at least, I mean, forget MBBS, it goes back to childhood. For me, dance was, I never saw it as a separate entity, or a, people say it's your passion, it's your hobby, it's what you do in your free time, an extracurricular. But honestly, for people like us, it is curricular. Otherwise, it doesn't happen the same way. It was always another subject in school. So you had homework, whether it's school, MBBS, MD, you have set of work to do there, homework, or you have to come prepared for the next day. It's the same thing with dance. You do your homework, you read, you come prepared the next day. Every day you have to come prepared, like how you would go prepared for your day at college or day at school. So dance and medicine for me was always, hand in hand like that. But in MBBS, it never really hampered me. See, the only restriction as medical professionals, I'm sure even Sahana will agree, is our number of leaves that you can take for your rehearsals and everything. So it's not that we're not practicing or we're not performing, but we have to do it at a time where everyone else would be relaxing. Our day starts once we come back from work, right? So I work right now at a 9 to 4 job, right? 9 4:30 almost. By the time I come home, evening is when I sit for my classes with my guru. I take my classes for my students, then I practice. I have rehearsals either early in the morning or in the evening. So the same 8 hours that goes during the daytime has to happen again another 8 hours before I hit the bed. So there's never a compromise that can happen. Ideally, you shouldn't, if you're a person looking to pursue two professions, I'm sure it's this the same with any other profession, as an architect also, right? You are, the day is packed, but the evening is what you make of it. And even during MBBS, I think the only time that I had to say no was if your exams fall on the same day as a show or a same day. That's the only time you are forced to choose your medical exams over a show. But otherwise, it doesn't really hamper you if you're able to manage your time after you work or go to school or college. If you come back and utilize the evening fruitfully and devote with the same attention, it's hard. You've really exhausted yourself during the day. We see patients, we see the microscope, we do surgeries, everything. We have literally given our 100% during the morning. Now we have to give the same 100% in the evening. It is exhausting, but we have to do it.
So to add on to Ramya, people ask me, when is your weekend? We don't have, I don't have a weekend at all. My weekends goes away in taking classes, and whatever she said was right. We will have to compartmentalize what we do. Otherwise, it is very difficult because in a month I get 1 or 2 holidays or leaves that I can apply, and that has to be a performance day. Otherwise, it becomes very difficult for me to like compensate the work. That's about it.
I think there was one common point which both of you said was that uh, there is a certain, I mean, there comes a certain point of time in everyone's lives where you have to prioritize your education and your academics, and like dance, you can always get back on track. But this one, once it's gone, you can't really get back on track, because I mean, especially in a profession like like medicine, which is so demanding, professionally and academically. So I think that's one thing which all aspiring dancers have to keep in mind. I think it's all about prioritizing and knowing what exactly to focus on at what point of time. Ramya, do you have something to add?
Yeah, I mean, although yes, I do fall in that category of where, we kind of prioritize education over the dance. But of late, if you were to think about it, at least at my stage right now, right? At my age and having finished masters, right now, if you were to ask me, would you give a few years to complete your education and or for study further, or practice further and then come to art field? I would say no, because as an artist, I'm speaking as an artist here, because as an artist, my body is at my prime. It can do anything it wants right now. Can this be the same 3 years down the line after I finish a career in medicine? There's a question we may not be able to answer. So at this point, that's a question, it's a tough question.
someone who's perfect in this panel to actually give us a clear answer on this question. Aparnaka, you've probably been through this stage, and you also have a family, you have children, so you probably your body has probably been pushed to limits where people say it's very hard to bounce back after that stage of childbirth and all that. So can you give us some insight on how this has worked for you and what you've experienced throughout these years when it comes to the changing needs of the changing dynamics of your body throughout this journey?
So I agree to what Ramya was telling. Dance requires a lot of commitment, and our body should also be ready to do all this balancing or like practice scheduling, having 8 hours of work and then come back and spend 8 hours, right? I can tell that what I could do maybe 20 years back, I was not able to do 10 years back, and I'm not able to do what I could do 10 years back today, right? It is demanding, even, yeah, like you said, after having a baby, our body itself changes a lot. And I have had a lot of health issues after having my son, that my knees, whenever I sit in Aramandi, my knees was hurting. I had to go for physiotherapy, and, it took time to bounce back. But again, if you have that strong determination, we can make it work. And as we get older, right, maybe we have that much energy when we are a school student to do like full margam at like a high energy items back to back and all. Might not be possible as you go older. Maybe that's when we focus more on like our abhinaya items, and just how we can balance between nritta and take abhinaya or thematic productions where you can come up with like creativity where you need to give that break. This is what I believe. Listen to your body. If the body is asking for, take it slow, because it is sometimes if we have a knee pain, and if we are not focusing on that, and if we just go forward with like more rigorous practice and all, it can only worsen it. So again, I'm coming back to how we can balance it. It might not be the same what I could do 10 years, what I could do today, but then you reprioritize, you see what works in this current situation, right? I think that is where, coming back to your point, where how my corporate life helped me here. So the creativity aspect of dance, it is also important in software life too, with the moving AI technology and things are changing. How creative you can think, how you can prioritize, how you can keep the commitments in a way that is achievable, with like achievable goals, and stick to it. Those things go balance back to back on corporate life as well as dance. So yeah, that's what I think.
Thank you so much. So, as we get into the gender spectrum of our panel discussion, we have a very special guest who had a slight technical glitch, I guess, and he has finally been able to join us. Welcome to the panel, Manas. So, can you please introduce yourself to our audience here?
Hello, Pranam. Well, myself, Manas Ranjan Sahoo, and I'm from Bhubaneswar, Odisha. So I'm doubly graduate both in Bachelor's of Science and Bachelor's of Design from NIFT, National Institute of Fashion Technology. So basically, I belong to a design background. So I'm an accessory designer. I'm pursuing multiple professions, I would rather say. I'm an entrepreneur as well. I'm pursuing handloom and handicraft as my forte, where I'm working in and bringing in new designs for upcoming markets or global markets. So I'm also looking into my dance, which I'm a full-time dancer as well. I used to balance both. So that's it.
Thank you so much. So we've got a designer as well in the panel now. So Manas, earlier we were just talking about how these women have faced gender stereotypes, or or how they've probably been lucky enough to have the kind of support they got from their professional circles as well. So as a man and being a classical dancer as well, and having a full time alternate career as well. Do you face any stereotypes for being a classical dancer, for being a male classical dancer in your professional circle?
Mm, yes, I have gone a lot being a male dancer. I guess it's not with me only. It's in general with every male dancer. So we, since childhood, we are being bullied for being a classical dancer. It's nothing very new to a society. And as I used to tell my friends as well that we are from 90s. We are 90 kids. So during those days, taking classical dance as a hobby as well was very difficult for us to tell. Even we have that hesitation to tell publicly that we love dancing. So yes, I have gone through those stereotype thoughts of society that classical dance are basically made for women, and women are fortunate enough to perform as a classical dancer, but males, uh, of course I would say, they don't have a very good view regarding male dancers. So in professional field also I have went through lot many uh, comments, bullies and all, but somehow I haven't paid attention to that, for which I still am performing today, and could thought of like taking dance to a new to, can pass it to next generation as well.
Right, right. Thank you so much. And as an extension to what Manas just said, I mean, I've had the good fortune of having a male dance colleague and having performed alongside with him. So I don't think the stereotypes and the whole bullying, I don't think all this comes from our peers in the dance circle. It probably comes from that segment of the society that is not aware enough to know that a male can actually pursue classical dance, and there's absolutely nothing wrong with it. I feel it comes from that section of the society that is not educated enough about this. And as so we have four of you who run your own dance schools, right? So how do you think we can inculcate this basic awareness in students, in younger children rather? So let's say if your student actually sees someone being bullied because he's a male classical dancer, what is it that they should ideally be able to tell them that actually ends that pattern right then and there? Can we please start with Ramya?
It's very, what do I say? First thing that they need to be told is to speak, open up, right? It's very common for kids to watch and go be mum about it. So the idea of, what do I say, facing it or addressing the situation, that they should not be scared to go up, confront, and say it, right? That's the first step that the child should make when he or she wants to support a notion that is sadly, stigmatized by the part of the society that doesn't understand or that doesn't know. It's just the lack of the knowledge that's causing this. So the best way for the child or for any of the youngsters these days would be to first be bold enough to go up to them and explain it to them that there is absolutely nothing wrong. Give examples, give peers, their own friends as examples, and only then, the closer it hits to the person who doesn't know, the better they understand that there is nothing wrong with having men also be classical dancers. It doesn't categorize them as something else just because they've learned the classical art forms. Or if it's the elder generation that is giving this talk of, or that is creating this misunderstanding, then we have our history to say that we have all the male history of our Bharatanatyam or any of the classical dances, right? I'm sure all of you will agree, whether it is Odissi or Kathak, all the big names, right? They're all men. And they know it too, right? Because they're from that generation.
Right, right.
Where it's close, where they can connect and understand. That's how they will understand.
I also
Uh,
feel that we'll have to make our dance class a very safe space for the students to open up and also appreciate art as such. So, the first thing we might have to teach the students is to look at art and themselves separately. Like it is just the art over the artist, so art will sustain and it will grow through the years. Even if art is being associated with the dancing body, but it is something beyond one's comprehension is what I feel. And all these kids should be taught to look at art from their perspective, whatever color they want to give to art, and treat art or dancing as their friend first, and tell them to appreciate their peers in the dance class. And we can create like a holistic environment in the dance class that will take us a long way.
Right. And yeah, I was just going to ask Parnaka and Pooja to pitch in because both of you take classical dance classes in the US and Dubai, respectively. So, how is being an Indian classical dance practitioner viewed by the rest of the society, especially by native, citizens of US and Dubai, like people who have absolutely no idea about Indian culture? Of course, it's changing. I mean, we see more Indians even in foreign countries nowadays. But my point is, how is all this viewed at? How do your students, I don't want to use the word market, but how do your students project themselves as classical dancers in their schools and in the societies?
Sadly, yeah. I first of all, I agree to what Sahana and Ramya has already addressed. Just to add to that, I would think from my experience, what I have seen so far, almost from like about all the like the art students, any dance form, right? Students we have in the US or even in India. Maybe I'm just talking strictly within US. Maybe only 1% or less than that of male dancers you can see. In my dance school, I just have like one male dance student, and he's so passionate about dance that he's just 7 or 8 now. So when he first performed last year, I got a lot of questions. Oh, does boys dance? That was the first thing. And everyone was like surprised to see. I understand that in India, it's we see more male dancers, but like that kind of an awareness is a little lacking everywhere, especially outside India, a little more, I would say. And as a teacher or as an artist, it is our responsibility to break that stereotype, right? How we can support. And this little boy that I have is very, very passionate about dance, that every day he just practices by himself, right? So, how, as a teacher, you can support and build that next generation that is coming up, how we can support them to build their confidence and be a better dancer of tomorrow. I think there is like a lot of responsibility on the teacher and some responsibility on all us artists to break that stereotype. And another one to add to that, when I had my son first, one of the questions that I was getting is like, oh, I hope next one can be a girl so that you can make her a dancer. So my next question is like, why? If my son wants to learn dance, I would definitely support it. And, why can't he dance? So that's the kind of questions that I've been seeing. So I think it's time that the young artists like come up and like break that stereotype and like make sure that it is like there is equality, and artists more than the artist, right? So the art matters the most, and how we can support the art despite of what gender you are.
Pooja, can you please pitch in?
Yes. So it's been not much time that I have started, like I have moved here in Dubai, but I have started teaching before moving to Dubai. And um, so, as rightly said by Aparna Akka, that outside India, it is still not that much aware that this Indian classical dance forms are also pursued by male also. So I feel this gap should be bridged soon, because if we are as a dancer are establishing ourselves outside India and promoting this dance, then it should be in a way that dance is perceived by both men and female, men and women. Okay, and I have two male students. One is a kid and one is elder than me. So the way they dance and the way they look and they don't care about anything is very surprising to me. And yeah, that's it from my side.
I think probably the society makes it a bigger deal than it is when they see male classical dancers. I mean, I feel many times we tend to forget that the deity we pray to before dancing himself, he himself is a male dancer. So I don't even find the need for such a stereotype to be brought in, but I feel we can't really blame the unaware segment of the society that even finds this to be different. So Manas and Lekha, both of you pursue alternate careers that are creatively aligned, right? So I had asked Lekha this previously. So at times, do you really feel that the choice you've made to pursue a creative line to pursue a creative career supports you in dance? Like, do you have connections from? Do any of the connections overlap basically? So do you find someone in your dance circle, and do you find someone in your professional design circle? Do you find any overlaps? Have they helped you pursue the other at any point of time? Have they been more supportive and more understanding that you have two different creative professions that you balance parallelly? Manas, we'll start with you.
Being a dancer and a designer, I would rather say D2, uh, I don't feel there is any difference both in dance and design, because being an Odia, I have imbibed an in depth knowledge before being a dancer, the in depth knowledge of Odia culture. Because unless I imbibe it, I won't be able to deliver it to the audience or to my rasikas, because same goes with designing as well. As I have already mentioned that I'm an entrepreneur as well, so I'm dealing with handloom and handicrafts of Odisha. So I would rather say everything in Odisha revolves around one thing that is called the Jagannath culture. So the Jagannath temple is to be the epicenter of everything. Right from our cuisine, music, art, everything that revolves around Jagannath culture. So being a designer, I have imbibed the technique, the skill set from artisans in Odisha, and tried out giving it a new dimension to my design field. Same, I have also imbibed the knowledge from Jagannath culture through dance, and kind of I have blended it together. So it have helped me a lot both in both the field. So I think I don't find any difference in both the field.
Lekha, what do you think? You've already answered a part of this a while back, but so I'm going to ask you an additional question, and we'll hear about this from the rest of our panelists as well. So, being an architect and a dancer, do you really feel? I mean, what are your thoughts on the money that comes in? So it's probably not easy as a full-time performing artist to expect the same kind of money. Of course, there are many full-time the dancers who have actually been able to achieve that through purely ethical and sometimes slightly unethical means. But my question is, do you really think it's easy to be a full-time practicing dancer and make the same kind of money you would make if you didn't have an alternate profession to back you up? So is my question clear to all our panelists? Okay, so we'll start with Lekha, and we can have each of you build up on that.
Before that, to add on to your previous question, like I said, it is both of it have been designed, and for my thesis of my master's degree, I had actually published a paper in a German publication which talks about using parametric architecture, which is an trending feature right now in architecture, where it uses parameters to define how the building is going to look. So I had presented a paper where I take features of Bharatnatyam. How do movements of Bharatnatyam, the Abhinaya aspects of Bharatnatyam, define the parameters in architecture to develop a building? So this was like your jigsaw puzzles or your building blocks. So how does every movement of Bharatnatyam define how I'm going to be placing that block? So there were certain rules that I defined, and so Bharatnatyam completely defines how that building is going to look. So that was my presentation on for my thesis, which also got selected for a publication in Germany. So it's quite interlinked, and I have used it to my advantage, is what I would say, because at every point in architecture, I have used my Natyam to define it. So this thesis project really took me to places, because it was quite refreshing when you see it across different projects of architecture thesis presented, which is completely only aligned to in a specific manner. But this was something that stood out because it takes from the arts, and it's completely an art form that defines how the architecture is going to be developed. And on a daily basis as well, I think as a full-time dancer, being a designer really helps. Um, in my own dance class, the Arangetram invites, the flyers, and whatever are the design aspects, and even the conferences which my teacher, my guru, hosted, the logo designs for all of it. I had the opportunity to do it, and I think I was skilled enough to be able to produce it. In a day, of times of AI, and where everything you get ready-made, you go to Canva, you have ready-made logo design, engines on social media and Google. It's so easily available. There is often a question that is a designer still, relevant in today's times? I think a person I think the job that a human brain does, I don't think it can be substituted by any AI methods. So a designer, yes, is definitely relevant even today. The kind of logo designs that a designer makes and what you get from an AI design is completely different. So that leads to the money aspect as well. So when things get easily available through AI designs like this, there again becomes a question of, do you require a designer? And same with dance as well. I think I don't see it from that financial aspect, because this is a choice I have made, and I'm very content with the choice that I have made. And I do it for the joy of dance. So that's it. I have no regrets about it.
Thank you. Thank you so much. Actually, before I move on to our segment on the monetary aspect of being a dancer, I'd like to just take one tiny part from what Lekha said, and I'd like to address it to the doctors in the panel. So I think Manas and Lekha, both of them spoke about how their professions are deeply intertwined in some way to the dance, how it complements them in being the dancers they are. But I mean, do you really see that kind of a connect in the field of medicine as well? I vaguely remember, I remember reading an article about Sahana. It was published during COVID, I think, on how she did a piece in Bharatnatyam, trying to portray problems people face in COVID, or how the world is trying to turn to a positive side. And it was very surprising for me to read. But then I think many artists kind of came out during the time of COVID to express their creativity in spreading a positive environment. But that aside, do you really find that kind of a connect in what you do professionally and in what you do as a dancer?
Of course, yes. Many a times I've tried to incorporate science into Natyam, and other way around also, because I try to incorporate music in the operation theater. That relaxes the patient a lot. And it is a small operation setup. And when the patient is lying down, he or she, gets tensed and stressed, and teaching them breathing techniques and psychological counseling before the procedure really helps. And I have also incorporated a movie setup inside the theater. I've studied how that really helps the patient, because the patient is relaxed. He or she keeps looking at the moving cartoons or dance or anything that is put on the screen. And I have found it very, to my surprise, it helps the patient, and anxiety really drops for the patient. And I also feel all the mudras in Natyam, they trigger a certain pressure points, and it does relax the mind. So I've studied about that, and I have also been fortunate to be associated and in writing articles on these aspects as well. So yes, I find a connect between science and Natyam, and that it can be interlinked. Yes.
Ramya, what do you think? Have you had that moment of realization yet, or is it something you're still waiting to explore?
Oh, so I've had a different realization when it comes to how parallel my dance and medicine are is it, pretty recently. I think it was after I completed my master's last year that it was just a session, and I came back thinking like, wow. So I'll just share that, and maybe that's how for me it's connected. But before going there, on a more physical day-to-day basis, to know how dance and medicine, they complement each other. A lot of learning. See, as a medical professional, we have to be precise, we have to be on time, we need to be thorough, we need to, know our theory before we even look at a patient or touch a patient. Before we try to put it into a practical aspect, we need to be well versed with our subject. That's a learning from medicine that I have tried to extrapolate into my dance, where we are all practical dancers, but we've also have to be theoretical dancers as well. A background knowledge with any work that you do, really it does give a different dimension to your dance as well. The same routine, the same focus that you give to your medicine or any profession as such, being on time, being precise. When we're doing surgery, we know the difference between a straight line and something that has a deviation, that's in a different plane, right? So same, that's it, that same visual dimension is what is also in dance. Dance ultimately is your visual art form, right? You are able to assess how precise you need to be in your dance as well. Let's put it the other way around. What can dance give you to this profession? As a dancer, we're creative, we're forced to be out of the box, spontaneous, all of that spontaneity aspects is what makes your medical life easier. Yes, we have books to follow and rules and procedures to follow, but sometimes it's not always like that. We are out of the box, and at that second we have to be spontaneous to come up with a diagnosis or a treatment or whatever it is in order to save a patient's life. So this is on a day-to-day basis how dance and medicine really complement each other. You learn from each and you implement onto the other. But talking about the main thing that I wanted to say, art for me as such, as an more and more I've danced now, it's a search for beyond yourself. We try to forget ourselves. It's the art, it's beyond the physical, beyond the metaphysical, right? Everything that's beyond you, ultimately connecting with that art, right? As she said, the art comes above the artist, right? So the search beyond yourself is the fundamental basic. As an artist, you practice, you try to forget yourself. When you're dancing, you want to be the dance, you want to be the art, right? That is a search. That's what we're doing in art. But if you look at it in medicine, in simple terms, medicine is now going from macro to micro. We started off with like a larger thing, then we're going into molecular, we're going into genetics, something more nano. But ultimately, if you see it, the search of going beyond yourself and going what's within, what's more inside you is ultimately the same thing. You're both searching the same thing in just two parallel paths. That's the, for me, dance and medicine. For now, I'm like, okay, my end point is the same. These are just two pathways to find it. One is with logical and reasoning and, facts and proofs. The other is through experience and creation, emotion, going beyond yourself. Yeah.
Thank you. That
It
was
is
so deep and insightful. I think you brought out everyone's thoughts on the topic. You just brought them all together. Sahana, you were
Yeah,
saying something.
yeah, it is so interesting that Ramya being a pathologist and she can like really relate to it, like looking into the microscope and finding
I
out.
see the nucleus of every
Mm,
cell in our body.
yes, so I can see where it comes.
I see beyond that, right? A
Hmm.
cell DNA, we see the DNA as well. I can see the smallest of the particles, and through dance, we are trying to see the largest picture, creation beyond you, the consciousness. It's the same.
I love how we are learning a bit of science and a little bit of designing in our panel discussion. So I
So
think that's the
also,
beauty of having people from diverse backgrounds together, discussing about a common topic. Sorry, Sahana, please continue.
I'm very thankful for to Ramya for bringing this up. Interestingly, my PhD is about dynamic navigation. It is about AI and it is like a robotic, semi-robotic machine where I do not look into the patient while I'm operating, and I look at the screen and my hands do all the work. So I'll be looking at the screen and I'll be working with my hand. So it does push me to analytically think where my hand goes. It's called haptic feedback mechanism because I need to know where my hand goes, and my eyes has to catch what I'm doing with my hand. So that is very similar in exploring space while dancing in Natyam, because you touch something which is not really there. So me working with AI, I'm like working on the patient, but that is really not there in the screen. So those are parallels that we can really draw.
Namaste. Thank you so much for watching the first part of our panel discussion. Why first part? So, during the course of the panel discussion, we discussed multiple topics such as gender stereotypes, problems faced by dancers balancing alternate careers, and so on. And we realized that 1 hour was not really sufficient to cover all of this in depth. So, to do justice to the experience of our highly renowned panelists and to talk about all these topics for a little while more, we recorded a second part to our panel discussion. Please click on the link in bio or check out the link in the description box to watch the second part of our panel discussion, the third episode of Nirvikalpa Talks. Thank you so much.